Genetic testing saved my life. Had it not been for the information I learned from the genetic testing, I would have been a statistic. I had no symptoms of ovarian cancer. I would have just perished from the disease and not be sitting here trying to educate people.
When I was 42 years old, I developed a lump on my breast. Never had cystic breasts. Went to a doctor, and he decided to do a biopsy. Lo and behold, it was a cyst, and under the cyst, there was cancer. I proceeded to have a lumpectomy, chemotherapy, and that was in 1989, and I had been cancer-free. 2008, just watching a TV commercial, which I have not seen since, about a gene, a mutated gene, that causes breast and possibly ovarian cancer. I got the information, had the test done, and lo and behold, I was positive. BRCA 1 and 2. I was advised afterwards to either get a full hysterectomy, taking the ovaries out because I had positive results with the breast cancer, or just observe, watch and observe. The ovarian cancer came in 2013, and I was treated for it and have since been cancer-free. I had passed along that gene to my daughter, who then took it upon herself to observe and watch. And of course, she observed, she watched, and they found ovarian cancer with her.
I was one of those rare ovarian cancer patients that had zero symptoms. All my bowel functions were normal, I was eating normal, sleeping normal, no back pain, no, none of your normal ovarian cancer, warning signs and signals. So I would have wound up being a statistic that I hope I'm not as lucky in passing a gene on to my daughter as my mother was to me.
It's like you check your sugar, you check cholesterol, you check all these other things. Ask the doctor if there is availability in that facility for BRCA testing to see if you have this genetic mutation. And if they don't have it available, ask them who does have it available. Ask questions, and if you don't get the right answer, ask somebody else. And if they don't have the right answer, keep asking until you find it, because they are out there.
Genetic testing for any genetic disease that results in breast or ovarian cancer is as simple as getting your routine blood test with your annual physical from your doctor. They just take an extra tube of blood. It doesn't affect you. It's not another stick. It's not, it's not anything involved. It goes right along with your routine blood work. They just take a separate vial of blood. You don't feel any different. But
easy.
It can change your life.
Yeah, it's easy to do.
There are many, many gifts that you receive around the holidays. Some of them are absolutely, absolutely beyond wonderful. They take your breath away. Then there are gifts that you get without knowing. One of them is genetic gifts, gifts that are not given voluntarily, gifts that are not received happily, but you get them nonetheless, and you can't refuse them. So they have to be dealt with. But there are ways to deal with them.
Laugh a lot, cry a lot. The harder you laugh, the harder you're gonna cry.
Your family history is everything. Ask questions. If you're lucky enough to have grandparents or your parents are still with you, ask questions. Did we ever have anybody that had this? Especially, these are conversations you can have. It's on the news every day. So bring it up. Bring it up at your dinner table.
It's not taboo. There, in 2016, going
it's not the
forward,
50s.
Yeah, it's no longer taboo to discuss all of these issues. And you can discuss them with your family, and most assuredly discuss them with your doctor. And I think a gift to give your relatives, your friends at a party would be the gift of knowledge about this devastating disease. I mean, she's had a double mastectomy and reconstruction so that the cancer could go to her breasts. So she's taken the opportunity to do that. And I worry about my granddaughter. I can't emphasize that enough.
But we have a caution light now. Our story happens to have this ovarian cancer component to it, ovarian breast cancer component to it, but everybody has a story, which means everybody has things that they should know about themselves because it's your story. It's very personal. Because of this warning light that we have, this caution flag, we're able to protect ourselves.
My granddaughter.
My daughter. We're able to look out for her. I've already had a girls' weekend where I made all my girlfriends promise that God forbid something happened to me, they're gonna make sure that my daughter goes and gets tested and lives a full life in case I'm not around to do it. You know, we all swore a pact, but it was mostly to know that even if I'm not going to be there to protect her, that there's somebody else that's going to step in and make sure that she's enveloped in that protection of getting the information that she needs to help herself.
I love you.
I love you too. Thank you.
Thank you. Tell every amazing lady.